Team, any questions before we begin?
Not really.
All
Are you
right.
guys ready? Thank you. Thank you, Megan.
Yeah, you were welcome. Well, I want to welcome our next vendor partner, CCD Care, a Gibbs healthcare solution. Today, doing our second demo for Demo Day AI. Welcome, guys. We're so excited to have you all here today.
Thank you, Megan. Hello, everyone. All right, I guess we can just go ahead and start. Well, good afternoon, everybody. Thank you for joining us today and giving us this time. We really appreciate it. And I'll start by saying that patient access is one of those topics that touches nearly every part of radiology operations. And I would say that even so, yet it's often discussed in fragments instead of as a system level challenge, okay? So today's session is about stepping back and looking at patient access differently, just a little different, not as a series of disconnected tasks, but as a strategic capability that directly impacts capacity, revenue, staff experience, and most importantly, patient outcomes, okay? So over the next several minutes, we'll walk you through some of the current market realities that we're seeing. Also our reasoning on why traditional approaches are no longer enough, and how by implementing an intelligent, centralized workflow can help you materialize or materially change the way radiology organizations operate, okay? So with no further ado, we'll introduce the speakers and start our demo session. And I'll briefly start myself. My name is Rafael Peña Pelletier. I'm an executive economist and data scientist. And at CCD, I lead the strategy across data science, workforce management, business analytics, and product innovation. So my focus is on ways to implement and use artificial intelligence and advanced analytics, both, right, to drive measurable business value through transformative technology and many other ways, but particularly in complex operational environments like patient access is, okay? And it's just to mention this work that we're doing here led directly to the creation of the iCare One, which is the software solution we're about to present to you. So I'll pass it on to Luis to continue and introduce himself.
Thanks, Rafa. So I'm Luis Arocha, Vice President of Customer Success here at CCD Health. I work closely with our radiology partners to ensure that technology investments translate into real operational outcomes, from faster scheduling, reduction in errors, lower handle times, improved patient experience, and overall better capacity utilization. And I spend significant amount of time interacting with our clients, which gives me a front row seat to the realities patient access teams face every day. I'll pass it on to Julio.
Yes. Awesome. Thank you, Luis. And my side, my name is Julio Tirado. I'm the Director of Business Intelligence and Workforce Management here at CCD Health. Mainly, I lead our BI, WFM, and analytics functions here at CCD, where we focus basically on understanding the complexity, performance drivers, and variability across patient access workflows. My role centers mainly on turning data into insights, and insights taken into action, and how our clients, how data affect our clients and our internal operations. With that said, back to you, Luis.
Yes, thanks. And thanks, everyone. So before we actually dive into talking about our solution and our platform, it's important to ground ourselves in the reality that most access teams are operating in today. Patient access is under tremendous pressure. Long handle times and wait times are overwhelming the staff. Schedulers are dealing with increasing complexity on every call. and organizations are absorbing the downstream effects in lost revenue and underutilized capacity. In fact, according to industry data, and this is of healthcare as a whole, approximately $150 billion are lost annually due to missed appointments. And that number alone highlights how access is no longer just an operational issue, it's a material financial one as well. So moving to the next slide, let's break down what's driving this. Roughly 30 to 40% of radiology scheduling calls involve very complex workflows. These are not simple appointments. They include either multiple exams, complex protocol rules, insurance verification, clinical screening questions that goes through very complex decision trees and coordination across locations. At the same time, many teams are still relying on manual insurance verification, which slows down scheduling and increases the risk of errors. Add to that siloed systems, and agents are forced to jump between tools, increasing cognitive load and handling time. And from the patient side, more than 70% report frustration with access barriers, and we consistently see higher no-show rates for manually scheduled appointments compared to more guided and digital experiences. So this combination of factors creates a cycle that's difficult to break without actually changing the underlying model.
Yeah, Luis, 100% agree with that. And thank you. Now I want to go to the next slide and basically take a look at what patient access is through data and how it looks through the data lens and how this has actually become even clearer. Access workflows are not linear. They are actually decision heavy, they're variable, and highly sensitive to small errors. From a data standpoint, specifically, we see variability in order quantities and payer rules, modality protocols, patient readiness, and agent experience levels. Traditional systems actually were not designed to manage this level of variability in real time. They rely on static rules, manual memory, and after the fact corrections. This result is predictable, longer handle times, higher rework rates, and inconsistent outcomes. To change your outcome, you need to change how decisions are supported at the point of work.
Okay, all right. I guess this is the time we have been waiting for, right? Let's go right to the to show you our tool, in this case the iCare One. But before we go there, what Luis and Julio just described is exactly the environment that led us to rethink patient access from the ground up. Okay, and I have to tell you that the problem is an effort. It's not necessarily effort, right? It's fragmentation and it's also unsupported decision making, and that's where the iCare One comes in. Okay, so what you're about to see now is an intelligent patient access and scheduling platform that has been built specifically for high complexity radiology environments. Okay, so at its core, the iCare One does three main things, right? And of course, we're gonna delve deeper into more specific elements and more specific items and features. However, at a glance, it centralizes workflows that are typically fragmented, as I have already mentioned several times. It embeds intelligence directly into the agent experience, as you're gonna be able to witness here on the demo. And ultimately, it enables organizations to schedule faster, which is one of our value propositions, but even most importantly, to schedule more accurately and with significantly less operational friction, which is what we're aiming for with this solution. And our design philosophy was very intentional, right? We did not set out to replace people. We basically focused on removing friction. We did not want to add more screens. So we basically focused on simplifying decision making, so having less steps on the same process. And ultimately, we did not want to create an additional system that agents or schedulers had to also add or use or include in their workflows. We focused on unifying the experience for them. So that being said, I believe we can just go ahead and show you the solution. I'm gonna change the screen and what we're presenting to the iCare one. Just let me know when you're able to see the new screen. All right, perfect. So I'm gonna start by from the very beginning, right? Which is one of the most important value propositions we're bringing into the table. Okay, so first, it's important to understand that this is not a platform that substitutes in any capacity your radiology information system. When it's completely the opposite. This is a centralized orchestrating platform that will enable us or will enable you to augment your patient access capacity. And the first element that we wanna showcase on the platform or that we wanna talk about is our centralized entry point and kind of the software agnostic design. So as I mentioned, since this platform is designed to overlay on top of your RIS, whenever there are complex environments in which you have, for example, multiple RIS um, platforms, pardon me, so everything will begin with a single unified entry point. So instead of training agents differently, depending on which risk they support, basically iCare One provides one consistent interface that, as I already mentioned, sits on top of your existing risks. Of course, important to mention, not limited to risks, but also EMRs, EHR environments. And from the agent's perspective, it feels like one system. So assuming we have multiple risk platforms such as Abadoc, such as ERAD, you are simply able to switch back and forth from one to another, allowing us to do what it's called scheduler pooling, basically. And from a leadership and technology perspective, it is flexible and it is basically future proof because we know a lot of moving pieces and multiple risk platforms are becoming a reality in more and more imaging groups. So that's the first very important element, the capacity to move or switch from one platform to the other. Okay. Then we go with the advance or the patient search. As you know, every interaction on patient access starts with validating that patient chart, validating that patient that is calling, right? So we identified through several analysis and market validation process that we ran. We identified that sometimes locating the patient record can take up to 30 seconds of any patient interactions. Mind you, that the average patient interaction or scheduling interaction in radiology is about 7 to 8 minutes, okay, on average. So we're talking about a significant percentage of that time only to pull up and validate that patient record. So to do all that identity validation, and of course being HIPAA compliant and all of the regulatory components that we need to comply with, we're allowing an automatic feature, since this platform also unifies telephony, which is a very important component. Understanding that you're able to validate a patient through a traditional way, right? For example, if I go ahead and search for my name, I'm able to quickly verify and identify a patient and look at that patient information. However, there is that automatic record locator function that we're going to be able to show you in a bit, that basically allows you to save some time, to trim a couple of seconds from the workflow, which might not sound like too much. However, it has proven to yield really good results in terms of efficiency. So again, we all know how like some of those hidden bottlenecks that are found in this process. So misspelled names, different naming conventions, partial or outdated demographics. Basically, what we're proposing here is the use of advanced phonetic match that combined that together with demographic validations help agents locate patient records accurately, but also faster. So as I mentioned earlier as well, when integrated with telephony, and I say when because this is a modular platform, you don't have to be integrated with the telephony. You can use only the iScheduler, which is the overlaying on top of RIS function. But the iCare One also brings that capability to integrate telephony and having everything on the same platform, which is significantly better for your schedulers. So we're all about making the process more efficient and reducing that average handle time, which directly impacts your staffing requirements. So the quicker the process goes, the less schedulers you need to schedule the same amount of appointments. Okay, so of course, maintaining quality and HIPAA compliance. Another really interesting element is this that you're seeing here on the left, which is the real-time agent assistance, very similar to what you probably see out there in the market in other solutions when it comes to guiding or actively guiding an interaction or a workflow. However, this is where iCare One really starts to differentiate from that you're accustomed to see in the market. Because as agents interact with patients, the platform provides real-time in-call guidance. And we're going to be able to show this to you in a little bit of time when Louis makes a call and you're able to actually see this working. But let us park this idea here, and we're going to come back to this point. However, it's important to note that this is not a static script. So it's not a PDF that you can have on your second screen. This is this is prompts, reminders, and similar to the next best action based, understanding the context of the call in order to provide support to the agents. So this as well helps in streamlining the process, but also reducing some of the time taken for the agents or the schedulers to perform their duties or to set up those appointments. So also important to mention here that one of the main objectives of this platform is reducing the human dependency so that tribal knowledge that gets created within your floors, within your operations floors, can definitely be worked around or at the end of the day avoided, just because this type of solutions will help new agents ramp faster. This will help knowledge to trickle down to the entire workforce instead of just having specific SMEs or concentrating the knowledge on the supervisors or specific people within your workforce. So it makes experienced agents more consistent under pressure as well. So again, the idea is not to replace humans. However, we wanna support a human and reduce dependency on human judgment. So all those judgment calls that are very nuanced to radiology practices and the radiology industry is what we're trying to target and tackle to reduce that human judgment dependency. Therefore, having easier trainings, allowing more people to be able to schedule appointments, sorry, in radiology. And I'm just gonna go back to the previous example, going to any specific client or end client profile. Moving on to the orders, this is also really interesting, the order entry and structured clinical capture. So when we talk about order entry, this is another area where yes, correct, indeed, Mike. So this is order entry is another area where friction, let's say, quietly accumulates. Um, so there's missing information, there's inconsistent coding, there's free text orders, there's even handwritten orders that we've seen in some practices, believe it or not. And I'm sure you're completely familiar with the radiology landscape. There's like we still use faxes to receive scripts, orders, and referrals. So iCareOne provides an agent optimized order capture experience that combines guided workflows with structured inputs. And so at the end of the day, the idea is that agents are able to capture information and basically the system will be able to assist, for example, with a standardized ICD CPT mapping wherever this is applicable. And at the end of the day, what we're trying to achieve here is improving accuracy and downstream data accuracy or data quality. So if we go ahead and create an order, if we just upload and order whatever order we can find on the system, I don't know, common order 3, this is an example. And of course, understanding that there's a lot of nuances. However, having the order entry parameters right next to the specific order is a recipe for success that we have seen, especially when there are specific systems where you have to open on another window or probably do several clicks and back and forths to be able to just do something as simple as entering an order. And let's just real quick go through this process. And osteoporosis, let's assume that I'm doing this right. Be mindful, I'm no professional scheduler. However, I'll do my best. And understanding that there might be, well, the ICD might be migraine, as we're seeing up here. As you can see, you don't have to know the specific ICD code. You just have to search for the name, and then let's say that I want to have the MRI of the brain with contrast. And so after adding the order and the ICDs and all of the different parameters, we can just go ahead and validate that this is actually what we want to incorporate, and we can go ahead and save the order. That way, the order gets automatically written within your RIS. So we get the success message, and we're able to just go ahead and schedule that particular appointment. Okay. So something else really interesting is, and let's go ahead and use this very same order that we just created as an example. If I just want to go ahead and potential osteoporosis as scheduling notes, for example, and then we select this particular exam and we just go ahead and schedule that appointment, we go into the SMART questionnaires and safety logic. And in here, and I'm sure you know, radiology is not just about finding an open slot. That would be almost too easy, almost unfairly easy, right? So you need to ask the right questions at the right time. So basically, what we're achieving here is that, well, ICARE-1's questionnaires are driven, sorry, by the actual procedure that is being scheduled. So all of these logics, instead of the agents knowing or relying only on what's written on the or what's configured on the wrist, we're able to leverage AI and machine learning techniques to have the best or the necessary questions all the time. And it's not only having those necessary questions, is about actually understanding that these questions will have a repercussion on the available time slots. So evidently things like gender, things like if the patient is claustrophobic, for example, which are a part of the alerts and allergies that you can add into the system. Those elements will go into the scheduling grid and will define which time slots you're able to offer to the patient on your interaction. So let's assume, just for the sake of this example, that we have a 180, not on dialysis, it doesn't have a pacemaker, doesn't have asthma, have never had metal, is diabetic, is taking medication, which medication is using, metformin, don't have any type of cardiac stent, it doesn't require any special accommodation, just for the sake of this example, right? Then you're able to just go ahead and click save and next. And of course, we're going to show you more in detail here, but this leads to the dynamic scheduling grid, which is also something we want to show you, because it is, so instead of bouncing between calendars or just manually applying protocol rules, agents are able to see the result of the entire process here. So this is a dynamic scheduling grid. So in here, you can see the exam that you are about to schedule. Of course, you can schedule multiple exams together, up to 3 exams at the same time. Let's assume we want to focus on morning operating hours. This is automatically the location where the patient lives. It basically brings that patient's zip code or address, so that everything else gets sorted based on that distance to site, which is really important as well. Let's assume let's go ahead and just present what are those time slots available based on that search criteria up here. And that way you're able to see, let's say for next week, on each one of your locations. And of course, this is dummy data that we're seeing here, but the Centerville location located at Brush Hill Road has availability at different times of the day. For example, in here, we can see the time that the study would start. So this one is availability for Thursday, February 19th at 9 a.m. For example, for the specific CPT code that we're looking for, with the specific modality, the duration of the exam, 30 minutes. And this way we're able to just show, well, if I save the scheduling notes and then I just go ahead and proceed with that particular time slot that I was talking about, and we're able to just provide proper instructions to the patient. So do not eat or drink 3 hours prior to the exam. Prior to fasting, drink plenty of water. Please arrive 50 minutes prior to your appointment time. All children must be accompanied by an adult, etc., etc. Things that allow you to also provide the right information to the patient. And then we just go ahead and confirm the appointment, and automatically, again, your appointment would be scheduled in your wrist as well. So this would automatically trigger that SMS or email confirmation or both to your patient based on that patient's preferences. And just like that, we were able to quickly schedule an appointment. Of course, we understand, well, as you can see, the order status now changed to schedule. So important to note and important to mention here that this also works in sync, in complete sync with your risk, meaning that whenever you select a time slot, this time slot, that particular time slot will get blocked so that nobody else, regardless of using iCare One or directly in the risk, nobody else would be able to offer the same time slot to your patients. That way, we reduce friction as well, and we make sure that these type of integrations work as intended, instead of becoming an additional problem. Something else that is really a one of our main value adds, and I just want to go ahead and quickly explain a little bit of the background. If we go back and we go to the already scheduled appointments, you're able to see something that, well, actually one of our flagships, which is the no-show predictive model. And we know, because we work with several, well, actually with regional, local, and national radiology groups in the United States. So we know that no-shows are one of the most pervasive issues in the market, right? So actually affecting patient access, but affecting radiology groups, okay? So we have included, or we have developed, which by the way is also another standalone product that we can delve deeper in a separate session, but we have developed a proprietary no-show predictive model leveraging machine learning algorithms. And just to cut to the chase, considering we only have a couple minutes left, this will be, or this is embedded here as one of the features of the iCare One. And what we're looking for here is allowing for proactive intervention. So bottom line message, not all appointments carry the same risk. So by leveraging a machine learning approach and a statistical approach, you can determine the actual likelihood of no-show for each particular appointment. We can discuss more details. So what would you do with this information? You can trigger confirmation campaigns. You can, instead of calling everybody, you can call your top 10% or the top 10% more likely or most likely to no-show, instead of having to call all of your patient base. So strategies like that one, or you can just go ahead and double book specific time slots that are where a high likelihood of no-show patients are scheduled. Among other potential solutions, bottom line message is this is also one of the important features that we want to showcase in this, that are included in this platform. I think that with no further ado, Luis, we can just go ahead and make the call and present a calling, well, a quick call scenario. And what we want to show you is how the agent assistant works in real time. So basically, Luis will be just calling in as we speak, and you're gonna see how this will be listening into the call and providing real-time suggestions to me, the scheduler in this case. So we can go ahead and do the call, Luis.
Are you available?
Yes. So also something else important here is on the same demonstration is the in this case the automatic record locator function that I talked about. So as you can see, once Luis's call reaches the agent queue, it automatically identifies that is Luis Arocha the potential patient that is calling. If there were multiple patients within the same or with the same phone number, they would all appear here so that the agent can actually perform its duty of identifying if maybe a duplicated record can be found. So thank you for calling the scheduling department. My name is Rafael. How may I help you, sir?
Yeah, so we're gonna go cut to the chase to some questions to see
Mhm.
the agent assist in action. So I have some pain in my leg and I need to schedule an MRI. I have a knee replacement and I want to know if it's okay for me to get the MRI.
All right, of course, I can definitely go ahead and help you out with that question. So you mentioned that you have that you want to schedule an MRI. So question here, may I have your first name, last name, and date of birth, please?
Yes, Luis Arocha, April 10th, 1976.
All right, thank you very much. Let me, so you said you want to schedule an MRI.
Yes, correct.
Okay. So I can see that you have here an MRI of the brain. Is this the one you want to schedule?
Well, for my purpose, I'm not sure, but I just know that I have a knee replacement and I want to know if it's okay to get the MRI.
Of course, I can definitely help you out with that, sir. So as you can see here, after identifying that the patient has and inquire about safety getting an MRI with a knee replacement, the AI is automatically fetching information in regards to this particular question or inquiry that the patient has. So yes, patients with knee replacement can typically get an MRI, etc. This is completely customizable, and this leverages advanced AI. In this case, we're talking about RAG, which is a method to fine-tune large language models. So bottom line message is this can be customized to your particular preferences, and any rules that are based on your processes can also be included here. Anything else, sir, that I can help you with before we
Yes, I have another
proceed?
question. I suffer from high blood pressure and I take medication every day when I get up in the morning. Can I take my blood pressure medication before the appointment?
Thank you for that question. I can definitely go ahead and verify that for you. As you can see, it's actively listening to the conversation, and it's just gonna build on top of the previous question, but the short answer is yes, it take or that patient can take his blood pressure medication before the exam. Please only drink enough water to take his medication, considering required in this case fasting periods for the exam. So thank you, Luis, for the example. I think we can go ahead and end the call. Important to also see that right after the call, the agent will get the actual transcription of the call, and also an AI generated summary that would allow the agent to also do the whatever documentation they need to do before the exam happens. So this is in a nutshell what we were intending to showcase today. What we can do now, I can just pass it on or share again my previous screen on the presentation, and maybe we can go directly into the closing remarks, Luis.
Yeah, absolutely.
Mhm.
Absolutely. So basically, to close, iCare One is not just another scheduling tool. It's designed to rethink how patient access should work in complex environments, and does not require replacing your current risks. And I think that's key. It's centralized, intelligent, designed around people, not systems. And we believe that patient access should be predictable, scalable. You don't have to replace everything just to use this. And patient-centered by design. So thank you for your time.
Thank you guys so much. With some time left, feel free to our attendees, if you'd like to ask any questions to our CCD care team, please feel free to type them in the chat or to put them in our Q&A feature. They will be here be able to be here and answer those questions until 1:45, until 2:30 p.m. Eastern time. CCD care team, thank you so much for sharing that demo and walking us through. Oh, we have a question that popped in. Andrew asked, would this replace our current phone system?
That's a very good question, Andrew. The answer is no. There are multiple options. However, this can be integrated to your current telephony platform or ACD via API.
Awesome, guys. Well, I want to say thank you so much for y'all's time today. And again, if you have any additional questions, feel free to place them in here. We'll make sure it gets to our CCD team. And thank you guys. It looks like they have their contact information here. Contact information will also be shared in the email with our recording. And I did share their LinkedIn as well.